Strategic plan for West Dallas Fire Department. Doing this for our leading as a general manager class for my graduate program. First things first, we're going to identify the objectives today. So identify a mission statement of the organization, identify stakeholders, conduct a stakeholder analysis, create a strategy map, identify department goals, develop a communications plan. So our mission statement, City of West Dallas mission statement is written right in our policy and procedure manual. It says the West Dallas Fire Department is organized and dedicated to serve, protect, and preserve the life and property of the citizens and businesses of West Dallas. We will provide this service with the highest level of professionalism we are capable of delivering in the fire prevention, public education, incident stabilization, and emergency medical services as effectively as possible. 24 hours a day, 7 days a week. Okay? Now, after reading the mission statement, we identified stakeholders that would be affected by anything the fire department does. Those stakeholders include co-workers, so that's your employees, whether it be firefighters, paramedics, lieutenants, captains, battalion chiefs, deputy chiefs, assistant chiefs, chief. So co-workers, fire department administration. So fire department administration is basically the 8-hour chiefs that we talked about. So fire chief, the 2 assistant chiefs, the 2 deputy chiefs, and then also the administrative lieutenants on 8 hours. Okay. Police and Fire Commission, that's our governing body. Anytime we do anything within the fire department, we have to get it approved by the Police and Fire Commission. They have to give us the yay or nay. The community as a whole is one big stakeholder. I'd say probably the biggest stakeholder. The public, so besides the people that reside within the community, the public, so anybody that comes into the city to work, anyone that travels through the city, anybody that happens to touch our city in any way would be affected. And then lastly, we put the press. The press is a big one because if you do something good, you may get a blurb at the 6 o'clock news. If you do something bad, you'll probably get way more than a blurb, and it's all that we're going to hear about for a couple months, and it's going to be a black eye on the department, the city, and firefighters in general. Okay? So we created a strategy map. Within this strategy map, we've identified 12 goals for the department. The 12 goals are then broken down into financial performance goals, customer service goals, internal business process goals, and then learning and growth goals. Excuse me. So within that, we have 3 goals within each section. Some of the goals include create additional revenue source through innovative programs, maintain increased or status quo budget even in a declining tax base, create a training center to hold multiple classes for additional revenue, adjust resources within the department to meet the needs of the public, maintain proficiency in cutting-edge modern medicine, implement state-of-the-art firefighting practices within our organization, implement saving processes with suppliers of medical equipment, develop apparatus replacement schedule, and then team up with other organizations to buy the same apparatus to drive the cost down. Continue to utilize computer-based technology and improve documentation. Cultivate a culture of physical fitness standards within the fire department. Implement succession planning within the organization, and then create mentorship programs for all levels of the organization. Okay. As I stated, each of those goals is broken down into one of the 4 subcategories, whether it be financial performance, customer service, internal business process, or learning and growth. Okay, so the ways that we're going to go about basically evaluating how well we do on each of these processes is going to be determined through our evaluation process. So under financial performance, the first one that we indicated was create additional revenue sources through innovative programs. One innovative program we can give it as an example is mobile integrated healthcare. That is essentially taking paramedics out into somebody's house that was released from the hospital in an attempt to keep them from going back to the hospital or calling 911 and taxing our resources. If we can go out there and send a paramedic out there and make sure they're taking their medication correctly, they're doing all wound care correctly, it's going to cut down 911 calls, and it's also going to help out the hospital, because otherwise if the patient returns within 30 days, they do not receive the pay from Medicare. So the hospitals are willing to pay us for that. So our evaluation process for that program would basically be, has the department increased revenue more so than the cost to implement the program? If it takes a lieutenant and a captain to run this program, a lieutenant's $80,000, a captain's $90,000. How much money are we going to have to make off this program to be successful? So that's going to be one of our evaluation tools. The other one, maintain or increased operating budget within the department. We need to stress to our stakeholders that we've identified that we need an increased budget. Every year we get an increased call volume. So our calls have increased 33% over the last 5 years. We're quickly approaching 10,000 calls. This year we're going to shoot over 10,000 calls with the same amount of resources we had when we were running 6,000 calls. Same kind of budget we were running when we were running 8,000 calls. So we need to demonstrate to the city government and the Police and Fire Commission that we need an increased budget. So our evaluation tool for that, has the department been able to successfully demonstrate the need for an increased budget or maintain the budget of last year? Last thing we want is to go down in budget, take a hit, but I'd say even a success is keeping the same budget as the year prior. Third, under financial performance, would be create a regional training center for fire and EMS. If we are able to create a training center for fire and EMS, we're able to cut down on the cost of sending our own personnel to classes outside. We are also then able to make revenue off of people coming and taking classes at our training center, whether it be fire classes, firefighter 1, making $1,000 off each student, or doing a paramedic class, you can make $5,000 off each student, over the course of a year. I guess our evaluation tool for that would then be, has the training center been able to bring in additional revenue for the department? That would be money that would come directly back to the department versus going back to the general fund, which is where most of our revenue ends up going from EMS transports and things of that nature. Then we move into customer service, okay? First thing under customer service is adjust our resources to meet the needs of the public. Within our mission statement, we identified that the public, the business owners, the businesses, anybody that resides within the city, lives within the city, crosses through the city, is affected. So that's one of our stakeholders. So we're going to need to adjust our resources to meet the needs of the public. As our call volume goes up, as we get over 10,000 calls a year, we're still running 10,000 calls a year with 3 ambulances. So one of our adjustments may be to drop 1 personnel off of a big rig, throw them on an ambulance. So we have 4 ambulances, and we're just short 1 person on possibly the ladder truck. 96% of our calls are for EMS. So are we able to adjust our resources to meet the needs of the public? So I guess our evaluation tool for that would be, have we identified gaps in the services provided, which we're overtaxing our personnel with EMS runs, then are we able to adjust resources to improve the services? If we could take 1 more med rig within the city instead of 15 to 20 calls a day for each med rig, we're gonna be able to drop that number significantly. Maintain proficiency in cutting edge modern medicine. We have an EMS bureau within the department. The EMS chief is always sending us information on new and emerging trends in EMS, right? So basically we want to take that information. If it's scientifically proven to be saving lives, we need to take that process and bring it here so our customers are getting that highest level care possible. And it's right here in the mission statement. Anything we're going through today as far as strategies or goals is coming straight out of our department's mission statement, because without that we have nothing, okay? So for for evaluating our modern medicine. How have we been able to implement cutting edge practices that are actually improving outcomes? So it may take a while to understand whether or not our processes are actually saving lives or improving the care of our patients, but that's an evaluation tool that we're going to have to use for that. The other section under customer service is implement state-of-the-art firefighting practices within the organization. Are we able to put out the fire faster? Are we able to cool it within the house a lot faster than we used to? Can we bring those temperatures down from 1200 degrees down to 300 degrees? Are we able to increase the survivability for possible victims within the structure? So I guess we're going to have to evaluate that throughout the upcoming years. Are the fires going out faster? You know, are we experiencing less injuries as firefighters going into these structures using new techniques that are brought forward? Are we having an increase in survival with victims of house fires? So we're going to have to evaluate that. Once we get down into our internal business processes, we want to implement a cost-saving process for purchasing medical equipment. As you guys all know, we go with the county right now. Anything they go with, we just give them money, they purchase it. We don't know how much it costs for a box of gloves. You know, it could cost 30 cents and we're paying $2.50 to the county. Where's the rest of that money going? So we need to be able to evaluate that ourselves and see if we can do a cost saving on purchasing medical equipment, because we go through so much of it. So you know, evaluating that, we're going to have to look at all of our resources and all of our third-party vendors and see if we can get a cost savings. Create and implement an apparatus replacement schedule with joint purchasing. We work very closely with other departments. We in fact have a training facility, the Joint Fire Training Academy, where when all three of our departments hire personnel, they all go through the same academy, learn the same things. So why shouldn't we be buying apparatus with other departments? Okay, you buy more apparatus, the price per piece goes down. So we buy one fire engine, it's $650,000. Okay, we join in with three other departments, buy 3 fire engines, it's $550,000 per engine. We just saved a lot of money. Okay, and we also want to take all these apparatus and make them all the same layout. So the firefighters coming here all use the same layout. Everything is in the exact same place no matter where you go. Make it easier. Okay, so that's why we're doing these things. That's an improve our internal business process. All right, so one evaluation tool is the schedule for replacement of apparatus, making it easier to create long-term plans and implement budgets in the future. Okay. Another one, continue to utilize computer-based programs to improve documentation. We've had computer-based programs for EMS for a while, and it's worked very well, better than pen and paper reports that we used to have, especially now that we have a lot of repeat patients. That patient is in the database. So you receive that patient, you write their last name, you can select that patient if you had them before, and it brings all their medical information back into your screen, and half your report is already done. Okay, so we're looking at more processes like that, more computer-based processes to make our life a little bit easier. You guys have a lot of work to do during the day. We'd like to cut down on that amount of work by putting in more processes that are computer-based to improve our documentation and all of our other stuff. So when evaluating it, are we cutting down on time, energy, and resources for all these little projects that we have to do for accreditation? All right, then lastly, we're talking about learning and growth. Okay, so this is more for like the personnel within the department, captains, lieutenants, firefighters. We want to create a culture of physical fitness standards. As we all know, heart attacks, leading cause of death for firefighters. All right, cancer rates are through the roof. So we're gonna create fitness programs. We're gonna have active stretching, yoga, stuff like that. And when evaluating this, are we seeing less injuries? Are we seeing a decrease in healthcare costs because we're going to the doctors less because we're more healthy? Are we seeing an increase in function? Okay, are you functioning better as a firefighter once we've implemented all these physical fitness standards than you were prior? All right. Another thing we want to do is implement succession planning within the organization. What we've seen for years is we didn't have the foresight to see when guys were going to retire. So all of a sudden, like 2012, you guys remember what happened? 2012, we lost, 18 people on one day? And of that, a good chunk of them were chiefs. chief officers, captains, lieutenants. So we lost a lot of experience on one day.